Hello again, my name's Christey. I'm a psychologist who specialises in sleep, and I've done a video already talking about the science of sleep and how it kind of works, and this builds on that. And I've also spoken about some rules for sleep to actually help make it more likely that you're going to sleep well. What I'm going to do now is just run through you briefly in about 10 minutes about how we treat sleep problems and what we do about them. If you want more information, have a look at Sleepio. And I've mentioned that before. It's a very, very good app which has got good evidence for it. And if you want to know more about treating yourself or treating your population, if you're referring a population, please contact us at Senti. So how do we treat sleep problems? First of all, we give people sleep hygiene information. So it's a list of do's and don'ts. That in itself is not a treatment for sleep. It's not particularly effective. Just giving people a bit of paper telling them what to do and what not, but is not helpful in itself, but it's a good foundation for the kind of rules. The other things that we'll start doing, which has more effect, is something called stimulus control. And what we do in stimulus control is that we restrict the bedroom for just sleep, sex, and getting dressed. So sleep hygiene, first thing. And stimulus control. Now, the purpose of stimulus control is to actually teach our body that our bedroom is for sleep. Otherwise, we end up going to bed to play computer games or reading or looking at a phone or looking at other digital devices. So we're trying to restrict all of that, take all of that out. Stimulus control would involve not taking your phone to bed, not using it as an alarm clock. Even if the phone's switched off, our mind can still be hyper aware that it might send a message through at any moment. So please be careful about what you have in the bedroom. Some people really benefit from a light, an alarm, which is a kind of progressive light in the morning, which helps us rise ever so progressively and gets our circadian kind of clock going. And so stimulus control, keep the stuff out of the bedroom. Other things that we can do is that we can figure out how much time people are actually asleep, and then if they're awake through the day, if they're awake through the night, then we can cluster that sleep up, a bit like shuffling books up on a library shelf. All of the gaps we kind of shove in, and then what happens is that we can actually encourage people to then slightly restrict their sleep. The rules of sleep include going to bed when you're tired, and I mentioned that in a previous video, and also having a fixed wake time. And what we do with sleep restriction is that we keep the fixed wake time, and then we go to bed a little bit later. Not much, have more than 5.5 hours sleep, or a window for sleep, and then the window for sleep opens a little later in the evening. You get slight sleep restriction. Talk to a sleep specialist about this, or go and have a look at Sleepio, which will give you more information. So some sleep restriction can really help. Not excessive sleep restriction. We don't want to deprive people of sleep. And the Sleepio is that app, which is very, very helpful as well. So sleep restriction. Now, some people, one of the common sleep problems is that people can end up out of sync with their social requirements or their environment or the sun, and then actually we end up with a circadian problem. And this is one of the disorders, is circadian sleep wake problems. This is a kind of wider problem, and please see a sleep specialist about this. Some people end up naturally kind of taking coffee or maybe melatonin, sometimes doing it at the wrong times and it doesn't work. Please seek advice about this. But one of the things that really helps with sleep problems is light. Now, one of the all of our cells have an independent timer. All of our organs have an independent timer, and they're all slightly out of time. It's a bit like an orchestra, just being out of sync, or lots of different instruments. So the conductor of the orchestra, the thing that keeps us in time, is an area of the brain, and that just sends the signals to all cells to remain in time. And then we end up feeling a lot better because our body's working properly. Now, that trigger in the brain that keeps the cells in time is managed by light. So light in the eye manages the cells in the body to remain in time. Now this is obviously, this could be a problem for blind people because they can not have a regulated time, and time tends to just shift if you don't have this regulated light. So light will just knock us from going forward in time, in sleep-wise, and it'll keep us to time. Now we can use light cleverly, and if you want your sleep to go backwards, you want to go to bed later, then you get evening light. And if you want your sleep to come forward, you get morning light before 9 o'clock. So these two will phase shift your circadian rhythm, and you can move it backwards or move it forwards, and it can be a very useful skill. And we can talk about that. You have a look at that in Sleepio, or you can see a sleep specialist on how you actually do that. But managing phase shifts can be useful for shift work. It can be useful for air travel, where you move across time zones. So some of the other sleep problems that we will deal with are the insomnias, and they can be treated with this sort of approach. And part of the insomnias will also be helping people manage their beliefs about sleep. And so talk to one of us about how you do that. It's something else you can look at in Sleepio. Insomnia treatment is incredibly effective, and Sleepio can do it, and sleep specialists can do it. Some of the other problems that we can get, the more significant problems, can be sleep-related breathing disorders, where actually our breathing will mean that we don't necessarily hit deep sleep, or we might go and then wake up, and then that can restrict the oxygen in the brain, and that can stop some of the functions of how our brain clears stuff out at night. And our brain clearance is an important part of sleep, and we need to get that deep sleep. And you'll remember deep sleep from an earlier video. Deep sleep, and hold that deep sleep to actually have the brain clear out. Every time we snore, wake up, bing, and if you snore like a champion, this can be a real problem. Then you won't be getting the deep sleep, and it can cause problems with, as I say, about actually helping your brain clear out stuff. And it can also stop recovery from physical exercise. It can stop. It can make people put weight on. Our weight shifted when we're in those sort of deep cycles of sleep. So we want to be sleeping well for managing that. So managing sleep-related breathing disorders is a bit of a specialist area, but you can have a mask which will keep you breathing properly through the night, and that makes all the difference. One of the clues that you have a sleep-related breathing disorder might be that you wake up with a sore throat or a dry throat, or need a drink, or you snore like a champion, and the person in bed with you will let you know that. So the air can be pressurized, slightly pressurized, and it keeps the lungs inflated. Some people can struggle with it, but really, honestly, it's that continuous positive airway pressure. A CPAP machine is revelatory. It can be really, really useful. And of course, some people with sleep-related breathing disorders are not going to sleep well at all, and they'll be really tired in the day, virtually to the point of just falling asleep. So if you have any of those difficulties, please see your doctor or see a sleep specialist. Some people can end up with extreme tiredness through the day, and again, see a doctor or a sleep specialist. I mentioned circadian problems, and one of the other difficulties that we see is parasomnias, where people can have problems where they're kind of not sleeping properly, or they can move around, or they can feel like things are happening, feel slightly hallucinatory, and those parasomnias are treated by a sleep specialist. So please go and have a conversation with your doctor about that. One of the last additional sleep problems, apart from the very common insomnia that we have, and these are all more, the ones I'm just mentioning are slightly more rare, but they are sleep-related movement problems. And what happens in movement problems is that we might feel like we can't settle until we've moved around, or we can't actually, or our legs can flick and jerk, or we can accidentally hit, and not intentionally hit the person that we're with in bed. So it's really important to get that treated. There might be some things that we can do about that, and it might be related to diet. So they're sleep-related movement disorders. So insomnia, really easily treated by Sleepio with some of the methods that I'm talking about here, and the rules that I mentioned in the previous video can be useful to actually consider too. And then for the other more rare and possibly more complex difficulties, then please see a doctor or a sleep specialist, and we can advise you about it at Ascenti. Get some pointers from Sleepio for insomnia, and if you want to refer anyone to us or you want to come yourself, then please just get in touch. Thank you very much. Thanks for listening. Bye.